Chronology of Primary and Permanent Teeth. Hi. Having two kids, I have always wondered, why do teeth have to erupt at different times? Why can't all of them just erupt at once? But teething is a continuous cycle of swollen gums and popping teeth that continues until all the permanent teeth erupt. But there is a brighter side to this. Did you know age can be predicted just by looking at the teeth? That's right. But this can happen only by knowing the chronology or sequence of eruption of primary and permanent teeth. Teeth have different times of eruption and shedding because the enamel organs are formed and completed at different rates. The development of teeth can be divided into four events. First is the initiation of calcification, which occurs in the late bell stage. Second, completion of crown formation. Third, formation of the roots, which occurs along with the eruption of the tooth. And the fourth is the completion of the roots, which occurs following the eruption of the tooth. Let's now discuss these events in primary and permanent dentition. The first evidence of calcification of primary teeth is seen soon after the jaws have assumed their shape in utero as tiny hemispheric structures. This is best observed on a radiograph. Calcification of the first primary teeth is initiated between the 13th to 16th week in utero. By 18 to 20 weeks, all the primary teeth begin to calcify. Calcification of the permanent teeth becomes evident 3 to 4 months after birth for all the teeth, except the first molars, which show some degree of calcification at birth. Beginning with the initial calcification of the primary central incisor to the completion of the roots of the primary second molar. The entire process of primary teeth formation is completed within 2 to 3 years. On the other hand, permanent teeth take 8 to 12 years postnatally to completely develop. Moving on to the second step, the crown formation. At birth, at least 2/3 of the crown of a primary tooth is completed, and it continues postnatally. This is different for the different primary teeth as shown in the table below. In the permanent teeth, the crown formation occurs for 4 to 5 years from the initial time of calcification. Moving further to the third step. After the crown completion, the roots of the teeth begin to form. The periodontal ligament plays a crucial role in tooth formation and eruption by connecting the tooth to the surrounding bone and facilitating the movement of teeth during eruption. The PDL fibers connect to collagen fibers in the tooth's cementum, allowing for occlusal migration that pulls the tooth into oral cavity. The process of eruption of the tooth is completed when most of the crown is evident in the oral cavity and when it has made contact with its antagonist. There is a supra-eruption of teeth and exposure of cementum, leading to sensitivity in the absence of the antagonist, making it clinically significant. The eruption of teeth in the oral cavity occurs only after 2/3 of the roots are formed, which continues to develop even after the tooth has reached the final stage of occlusion. The final event is the root completion. In primary dentition, the root formation in all the teeth is completed by 3 years of age, while in permanent dentition, it takes about 2.5 to 3 years post-eruption. The tooth formation is said to be complete when the entire root is covered by a layer of cementum. Did you know? The eruption of teeth is a defining moment in the development of oral motor behavior, like the coordination of lips, tongue, and other oral structures, thereby helping in speech, swallowing, and mastication. Let's now discuss the chronology of primary teeth. Between the 6th and 8th months, babies are like little explorers. This marks the start of teething, a time when babbling turns into chomping. The first primary tooth to appear during this period is the mandibular central incisor. By the 8th to 12th month, these little explorers begin mimicking speech and non-speech sounds. An important factor in this phase is the development of the maxillary central incisors. Just about a month later, the chomping crew gets bigger. with the maxillary lateral incisors joining in. Babbles begin to sound like actual words, such as mama and dada, between the 10th and 16th month, when the mandibular lateral incisors join in, just in time for the first birthday party. Now that the mushy cake phase is all done, it's time for real food. Between the 13th and 18th month, the baby's chompers are ready for solids, thereby welcoming the first maxillary and mandibular molars. Between 16 and 22 months, the maxillary canine makes an entry, just when the baby is set to feed himself. No more mushy purees. It's all biting and tearing at this point. A month later, the mandibular canine erupts. Here, it is important to note that after these teeth have erupted, the process takes a break. Finally, the maxillary second molar appears between 23 and 31 months, while the mandibular second molar appears between 25 and 33 months. Therefore, by the third birthday, the child now has a full set of primary teeth, can talk in sentences, and also make food choices based on their vibrant colors. The visual in front of you summarizes the eruption of primary teeth. Feel free to take a screenshot. The present chronology followed is by Lunt and Law. But did you know? The Chronology of Human Dentition by Logan and Kronfeld in 1933 was accepted for years and then continued by Krauss and Jordan in 1965 and Nomata in 1964. Let us now learn the chronology of permanent dentition. The story of the eruption of permanent teeth is like watching a child grow up. Just like how a child learns to crawl before walking, mandibular teeth come out first, paving the way for maxillary. Sometimes there are exceptions, like the maxillary premolars. The eruption of each tooth is like a step in the journey of dental growth that reflects the maturation of a child into an adult. Picture the three wise men of dentition: the mandibular first molar, the maxillary first molar, and the mandibular central incisor, emerging together like companions in a journey at around 6 to 7 years, mirroring the early stages of childhood where fundamental skills are acquired. This is clinically significant. Because these teeth are the first to erupt, their periodontal status is compromised when compared to others. Following this trio, a duo emerges that defines the aesthetic charm of the smile: the maxillary central incisors and the mandibular laterals. Their appearance at 7 to 8 years coincides with the blooming phase of the child's personality. As time progresses, individuality asserts itself in the child, and at the same time, certain teeth make solitary entrances. The maxillary lateral incisors erupt at 8 to 9 years, just like the child's growing independence. Next, we have the mandibular canines at 9 to 10 years, symbolizing developing strength and determination. Then comes the maxillary first premolar, erupting at about 10 to 11 years, reflecting the development of unique characteristics. Teeth then form partnerships in eruption, much like friendships that shape one's journey. The maxillary second premolars and mandibular first premolar emerge, hand in hand, at about 10 to 12 years. And with the progress of dental maturation, alliances continue as the mandibular second premolar and maxillary canine rise together at 11 to 12 years, showcasing shared experiences and growth. The maxillary canine has a long root, making its eruption path longer. In a big moment, like a competition in the teenage years, the second molars of both maxilla and mandible compete like big tech companies. The mandibular second molars take the lead between 11 to 13 years, showing friendly competition and progress, while the maxillary second molar erupts at about 12 to 13 years. Finally, in the late teens or early 20s, wisdom teeth show up between 17 to 21 years, marking a time of maturity and understanding. Therefore, the sequence of eruption is: here's a mnemonic to help you remember. Feel free to take a screenshot. Let us move on to the clinical significance. The estimation of dental age is one direct application of chronology. It can be assessed both clinically and radiographically. However, the clinical method is preferred as it does not require any special equipment. The last tooth to clinically erupt helps to predict the age of the individual. How does dental age assessment help us? It helps in treatment planning to decide the appropriate treatment age of the child and choose an appropriate orthodontic appliance. According to Demirogen and Goldstein, other methods of age estimation are assessing the biological age, skeletal age, morphological age, dental age, and using secondary sexual character as an indicator. Pop quiz. Before we wind up, let's go over the key points. The time of eruption for primary and permanent teeth varies greatly. A 6-month variation from the usual eruption date is considered normal. The teeth that present at birth are called neonatal teeth, and the ones that erupt within the first month are called natal teeth. Eruption variations are influenced by prenatal, perinatal, and postnatal factors. Eruption chronology may differ based on geographic location. Girls typically precede boys in primary and permanent teeth eruptions. Mandibular permanent teeth erupt before maxillary in both genders. Chronological and developmental ages may differ due to hereditary and dietary factors. The sequence of eruption and the chronology are important developmental milestones during the growth and development of a child. Absence or deviation may be an indicator of an abnormality, which we will discuss in our next session. We hope you had fun learning with us.